today what I'm going to be talking about is one of my favorite topics, and that is orthodontic treatment in young children. So a lot of times what will happen is you'll also get this what we call an open bite, and a lot of times is if the top teeth don't overlap the bottom teeth like this, your child will bring their tongue forward and put that, having their tongue forward in that space will always prevent the teeth from coming down and coming together properly. And as a result, your child won't be able to tear food correctly, and this could actually create a lot of problems for you. And it also can create a lot of speech problems. So if this is something that you see or you look at, this is something that's caused because the top teeth, right, are too narrow and the tongue doesn't have enough space, so we're going to want to widen or make room for the tongue, and we do that by using orthodontic treatment. We're going to be talking about this issue of when to choose orthodontics versus cosmetic dentistry. And just to kind of refresh everyone, when I'm talking about cosmetic dentistry, I'm talking about choosing to do veneers or crowns in order to straighten your teeth or improve your smile. And so what we talked about last time was that there's going to be instances where orthodontics is the preferred method of choice, and there's going to be instances where cosmetic dentistry is the preferred method of choice. And then we also said that there's going to be times where a combination of the two treatments is actually going to be warranted. And so today what I wanted to do is kind of bring up one particular issue that I think is going to be very interesting to talk about, and it's when you want to choose between having a crown done or replaced versus actually incorporating orthodontic treatment into it. And so here in this particular example, one of the things that you're going to see is that there's a difference between where the tooth meets the gum tissue here and here. And so when this patient came into our office, their concern was that they needed to have a new crown done and it's really done for cosmetic reasons. They wanted to have they didn't like the color of the crown. Now, if the dentist goes in and just replaces the crown without taking into account where the gum and the tissue meet, where the tooth and the gum tissue meet, then if you really imagine this, if they go and replace this crown as is, then what's going to happen is that you're going to have one really large tooth and one really small tooth. And aesthetically, that won't look good. And depending on how that person smiles, you can end up having, I always joke about this, but you can end up having one tooth look like a horse tooth and one look like a normal tooth. And so in this scenario, one of the things that you can't do with cosmetic dentistry alone is change the gum heights. So one of the things that we would say in this particular case is that if you're really trying to achieve a smile where the gum heights are even or like symmetrical, we're always talking about symmetrical or symmetry, then in this particular scenario, you can't make that change with cosmetic dentistry. So you have to use braces or you have to use Invisalign. So, and the cool part about it is when you move a tooth, the gum tissue moves down and up with the movement of the tooth. And so in this particular scenario, what we did is when we put the braces on, we actually caused this tooth to come down. And you can see in the final picture, after she got her new crown done, the gum heights were there and there. They're actually perfectly even. And so this gum symmetry is only achievable through the use of braces or Invisalign. So when you're talking about that issue as like a complex issue in trying to improve someone's smile, in this particular case, anytime you have these aesthetic gum concerns, then the likelihood is more likely you should actually choose to do a combination of orthodontics first and then do the replacement of the crown. And so that's what we did in this case, and that's how we ended up getting a really great symmetry to the smile. And because when this person smiles, they show the gum tissue, so it actually makes a big difference. And so that is the big thing I want you to take away from here, is that if you're trying to create gum symmetry, you can't use veneers or crowns to do that. You actually have to incorporate braces into the modality of treatment. We are now in the process of talking about this issue of cosmetic dentistry versus orthodontic treatment. And so last week we talked about a situation where I had a patient come in who needed to have orthodontics done first in order to have her teeth, one of her crowns, look like the other front tooth. And so what we did is we did a technique where we used braces to match up the gums. And so this week what we're going to do is I'm going to talk about a different scenario, which is kind of similar, but a different outcome, okay? And so we have this person, this is how they came in. And what was really interesting was her dentist gave her the option of doing cosmetic veneers from canine to canine. And so one of the things that when she came into our office, and the idea is that he was going to do a veneer on this tooth because of the discoloration. This tooth was set back, and so what he was going to do is put a veneer or like a crown and just kind of push it forward. So from this side to this side, she was going to have veneers done. And she told me, she was like, he called it like instant orthodontics. And so one of the things that I showed with her, and we sort of talked it through, was she didn't want to have she didn't want all that crown work done or all the veneer work done. And she wanted to try to keep her natural teeth. So I said to her, like, that would be a perfect opportunity. You can get a great smile if we do orthodontics. And so we did brace, so we ended up doing braces, and this is the outcome of treatment after about 14 months. And you can see the perfectly straight teeth. So really she really didn't need veneers, okay? But it was really interesting. I got to this point, and relating back to last week's issue, you can see that there's a difference between the gum heights, where the tooth and the gum meet on this side versus this side. And I told and I shared with you last time, okay, that when we want to have symmetry across the gum heights, across this area, I said, well, you can actually move a tooth up and down. And so the question is like, why didn't I do that here? And so the reason I didn't do that here is because she wanted to keep her natural teeth. So if I would have moved these up to match this side, then I would have forced her to get veneers on at least 2 of the teeth. And so as a option, what we decided to do instead was there's a procedure that can be done. It's called crown lengthening. And so what we did is we used a little laser and we actually cut away some of this extra gum tissue so that this tooth and this tooth were more even. And as a result, we also did it from here to here. And as you can see, we transformed the smile from here to here using a combination of braces and what we call a gingivectomy or gum surgery. So that combination actually worked pretty well for her, because then we were able to address a couple things. One, the crowding even on the bottom and the top. And then one of the aesthetics concerns is that when she smiled, she didn't like this. And so we used a laser to create this symmetry, and then she was really happy with her smile. And so I just am showing you this is because in some certain scenarios, cosmetic dentistry isn't the solution, but orthodontics and sometimes even a little gum procedure can make all the difference in the person's smile. Okay, so hopefully this was an enlightening. If you have anyone that, if you have this situation, or, please let us talk to us, and we can kind of work and determine what the best solution is for you to give you a great smile. One of the questions that's most on people's mind is, what is the cost of Invisalign? And so what I wanted to do today is kind of digress from what we've been talking about and go over this like much requested answer. And so what is the cost of Invisalign? I think what you're going to see across the region, whether you're on this side of the United States in Arizona or whether you're on the East Coast, you're going to see a range of costs for the orthodontic treatment using Invisalign. And that's going to range anywhere from $4,000 all the way up to, I've seen as high as $8,000 to $9,000. Whether you're seeing an orthodontist or, you know, sometimes we get this a lot of times is your general dentist will offer orthodontic services. And so what I wanted to do is kind of do a comparison about that. And so a lot of times if a general dentist is offering orthodontic treatment, they're also doing it at the same relative cost. And so what I want you to kind of understand is that there's a big disparity between the two. One of the things that's a big difference is the amount of training that a dentist has versus an orthodontist in terms of understanding tooth movement. And so one is, you know, it could be a one-day course to a couple weekend courses versus actually doing a whole training program, a 2-year training or sometimes 3-year training program in orthodontics. I think what you're going to end up spending is you're going to probably have monthly payments somewhere between $150 to $200. Some offices might be able to do it on a lower monthly payment, but for the most part, you should expect an average of that. And so there's times where I see Invisalign being offered at less than $4,000. Those are really interesting because I've seen that done in Groupons or some other like special promotions. And I just want to kind of let you understand most times that people that are doing those type of Invisalign ads, they're typically at general dentist offices, and so in order to get that that type of treatment or at that cost, a lot of times you'll end up needing to do a lot of dental work before that. So it's kind of hand in hand, and so you just got to be leery about Invisalign treatment that's being offered to you at $2,500 or $3,000. I always see like a lot of hidden costs behind that. And so hopefully this gives you a little bit of an estimation what Invisalign treatment does run. Again, like I said, I think it's going to vary across the board, but typically it'll range anywhere from, like I said, $4,000 to $8,000 depending on the severity of treatment. Okay.